Implants are a fantastic service. We do implants a little different than a lot of dentists do. We use a CT-guided implant system. So in other words, we're putting an implant in through a little teeny tiny hole in the gum. And we're doing all of our information based upon the CT scan that we take. So we know where the bone is, we know where the implant needs to go, so we place it in through a little tiny hole instead of having to, what I describe as peeling the gums back like a banana, okay? The nice part about that is that after we place the implant, there's very little postoperative discomfort. The patients, typically I'll call them up and say, how you feeling? They say, well, when's this gonna start to hurt? Probably never. Okay, it's just not something that's part of the program. There's really no need for it to hurt if you do it the way we do it. Now, not every implant lends itself to that type of system, so we certainly would be glad to go over with patients what their options are for their individual case. But most of them can, and it works really well. We do mostly single implant, single tooth replacement. I have several cases that we've done that were, I don't do any like all-in-4 type stuff. Typically, if I'm going to do implants, I'm going to support a denture. I place the implants underneath the denture, let that heal, and then go ahead and put stuff over the top of it. And then also do just conventional locator type to hold that dentures to hold them in place, that kind of stuff. But I do immediate loads. I do immediate loads on single teeth, depending on where they are in the mouth and how much bone I've got and how much length I've got on the implant. So we do some immediate loads on those. But most of the stuff is just single tooth, that type of stuff.